Hello, good morning, Rebecca.
Good
How are you?
morning. I'm good, thank you. How
Where,
are you?
where are you calling from? Where are you based?
So I am based in Belgium, in Ghent.
Mhm.
I'm not from here, but this has been my home for the last 9 years.
Fantastic. So, Rebecca, thank you so much for joining us today for our first interview.
What an honor.
So, you are a coach, a health coach. Can you describe a bit more what do you do and who you are in a
Okay.
few words?
Yeah, sure. So I work mostly with people with chronic pain symptoms. This can be like all different kinds of pain from fibromyalgia or IBS or arthritis. And but I well, do mostly everything around health. That's why I call myself a health coach and not just simply for chronic pain, because I feel that all the modalities that I use with chronic pain patients also like apply to health in general. So all of what I do is based on mind-body connection, so the whole mind-body approach, and a lot of like natural healing modalities.
Okay, sounds really fantastic. So us as Level Wellbeing, we try to bring more holistic approach to heal in natural pain relief, such as acupressure, acupuncture, and cold water therapy. And this is why we are so grateful to have you here today for our interview, to communicate about the fact that there is chronic pain and there is a way holistic approach and natural approach to relieve it. And so this is why it's really great for us to, have you here to spread your knowledge. So the first question, can you describe your personal experience with holistic approach in managing chronic pain, focusing on methods like breathwork, grounding, or exposed to nature? If you can highlight us.
Yeah, sure. So for me, what's one of the main factors of dealing with chronic pain is to really listen to your body and going within. And what we see with a lot of chronic pain cases is that the default treatment is to often numb the pain. And I fully understand this, especially if you're someone dealing with it and you are in pain every day, you just simply want it to stop.
Yeah.
And I absolutely get that. The message that it is chronic and that you have to deal with it for the rest of your life also doesn't really help. It makes us feel like hopeless. And you often hear that there's like a certain disassociation from the body because the body starts feeling like kind of your enemy.
Yeah.
And I try to remind people that, like in any type of pain case, the pain is never just random. It's always a message that there's something wrong.
Yeah.
And trying to like resist it is usually not what's going to help it release. And it's funny because my mom always used to say to me when I was younger, listen to your body, listen to your body. And I never really knew how much of an influence or impact that had until now. My default is therefore always to do that for myself before finding external remedies. I'm not saying that there's no place for medication or those kind of
Mhm.
things. I just don't think it needs to be the default. And often nowadays, what we see, which is with most kind of illnesses, there's two things. Like one, you need to go to an expert to tell you what's going on inside your body and what's best for you. And two, there's often the tendency to go for either numbing or like surgery cutting it out, or and I think yes, sure, there is a place for those things, but it shouldn't have to be the default. And especially
Yeah.
with chronic pain cases, that we see that it doesn't actually help. So what I'm trying to do is go back to the basics, and with the basics, like then you go to a lot of those natural remedies, and to help people to go back within, get back in touch with their bodies, and listen to what's going on, like get that mind body connection
Yeah.
back, because we are born with that, like all kids like have a natural connection to their bodies. And so to help them go within and listen, like breath work really helps with this, grounding, being in nature, these are all elements, and we'll go into them in more detail later, but these are all ways to do this more naturally and yeah, get that mind body connection. Because what I think is nowadays we are really focused when we're talking about sickness on the what it is and what can we give to stop it, rather than why it is and what the root cause is of something.
I mean, it's so true. Nowadays, if we have a stomach pain or a headache, we're just gonna be like, oh, I take this painkiller because it's instant relief. Instead of most of the time, if you have pain in the stomach, let's say chronical is like that appear a lot of time, right? It's not a painkiller that's gonna release the pain. It's like most of the time there is something deeper that could be with a mind problem, such as depression, such as too much stress. And
Yeah,
I think that we totally forget this connection because we don't have the time. We don't want to see. We don't want to have to deep dive into our mind to know what is happening. And I think we need more connection, more back to the roots, because normally
absolutely.
we should be able to see where is coming our pain from and be able to heal it. So I think it's really important to spread this message right now. So it's going to link to my second question. What are the key holistic strategy an individual can explore to manage chronic pain naturally, particularly through movement or, for example, nature-based therapy? If you can highlight
Yeah.
us.
Okay, so there's a couple of facets when I deal with chronic pain clients. And I think one that we haven't discussed yet, but that is very important, is pain education. And that's because, well, it's one of the main reasons we let others or experts tell us what is going on in our body, is basically because we lack the knowledge. We don't really know how our brain and our body communicate. We don't really know about the nervous system, how that is involved. I mean, some people have like a little bit of knowledge about this, but usually not in detail, or how this affects their pain, because this is usually not what is discussed in the doctor's office when you're talking to one. And so when we start to understand how this is all working, and how the patterns we have developed, so like also like living or moving more carefully, that also flags to your brain, for instance, like, oh, this is a dangerous situation. So it is normal that the brain then automatically sends more like pain signals. And if you repeat that long enough, you create like neural pathways that are completely based around pain. So just this angle of pain education is super important for people to understand, like, oh, okay, so this is what happens in my body. And then you can start to learn to work with it. And now we get into the second part, which is like those basic healing modalities that we've discussed to really go back within. So the breathing, the being in nature helps us really calm that nervous system and find that reconnection. And because if the brain is in the state of stress, it will not know that we can heal. It will not go into the parasympathetic state that allows us to, that repair mode. So we want to kind of break that cycle. And it also, like, going within also includes an emotional angle, because most of the pain is not, or not all of our pain is like purely like a physical problem. Sometimes it's just like a matter of repressed emotions in the body that, if they're not released in a healthy way, like think about like anger or grief or shame, like the big ones, they can also sit and come out in another way, which can be pain. So those are angles. And then a third one, which is more around movement, is like slowly pace back into activity. Because what we see with a lot of chronic pain cases, that people know that, oh, if I do this movement, I'm going to be in pain either tomorrow or like an hour from now. So it is normal that you start avoiding those movements. But then you kind of develop this cycle that reinforces itself. Like, you tell your brain that it's right to flag this as dangerous, so you're going to avoid it. And then you stop using your body, and it doesn't allow it to recover. So what I try to do is then work with people to, slowly build that back up again, with the knowledge that there's nothing structurally wrong. I do recommend people first like have that checked, that there's nothing structurally wrong. And then you start working with that to build that back up and get back that confidence in your body and in yourself.
And so you as a practitioner, as a health coach, how many, I mean, when you do a kind of therapy, because you do therapy, you do coaching, right? So
Yeah.
how many months do you reckon to, really start to feel this connection back? Because you are kind of doing, you have several caps. You do the kind of, so coach in a way that's therapeutic, but also like doctor. So it's a kind of, multitask personality that you need to have. And so because you are targeting the three different body, mind, and soul in a way. So how do you think, like how much months, weeks before? I mean, I know it's depending of each person, but it's a journey, correct, to change this pattern.
Yeah.
So
Well, first, I wouldn't call myself a doctor. Like what I try to do as a coach is really help people gain back their confidence in their own body and listen to themselves and not per se to me. I just educate on like the basics, and then the rest is more like, okay, get back in touch with you. So that just as a
we're
side.
a mind doctor. We can call it like this, a
Oh,
mind doctor.
okay. Um, no, so for journeys, I've had normally I do sessions. I put at least 2 weeks because you do want to see some changes. I've had people like the shortest has been after 3 sessions already like not feeling pain anymore, which still for me it still feels like a miracle, right? And this was a person that was dealing with pain for 15 years, and she was very open to everything, and she really went into all these modalities with an open mind, and the changes were just remarkable. And some people took let's see, what was a longer one, like 5 months, but still it depends on like what case it is, what you need to work on, and some things just need a little bit more excavation and really like going within and getting to know yourself again. And so it really varies from one case to the next, but just the fact that it is possible for me
It's
is
fantastic.
it's so hopeful, right? It's like, yeah.
It's such a nice alternative as well. If you're suffering from pain since so many years and you try every traditional medicine, it's a good way to heal you with yourself. So
Yeah.
that's why it's highly important.
Yeah.
Um, so how do you see exposure to nature playing a role in pain relief and holistic healing? And if you could share your insight of experience in utilizing nature, for example, to heal chronic pain, like nature, proper nature.
Okay. So let's start with nature before we go into the grounding element. So there's been like many studies nowadays that show the benefits of like being in nature for both our physical and mental well-being. And if you think about it, it makes so much sense. Like we humans have lived in a natural, like nature environment for hundred thousands of years, and all of a sudden, yeah, it's more like well, the last so many years, the shortest part of our human existence has been in these non-natural environments. And so it is very normal to see that that has a very positive impact on us. So they have done studies to like put a number on it, and they said like at least exposure for 2 hours a week has significant benefits for both our mental and physical health. And this can be like taking a walk in a park, or if walking is still a little bit too much of a stretch, you can just sit in nature and just surround yourself with it.
Yeah.
I think the Japanese have a really cool term for this, which is called forest bathing. Is really this like emerging in a natural environment, which I really love. And so what that does is it helps to disconnect, because we're constantly like, connect to everything on the move. It helps us to disconnect and go within, to slow down. And all of this helps us to activate the parasympathetic nervous system, which allow us to decrease the stress, decrease the cortisol. There's so many benefits to that. It helps us sleep better, has been found. And these are all things that also benefit our healing journey. So it's like this like cycle. Everything is like, intertwined. If we do this, it benefits there. You see what I mean?
I see, but tell me if I'm wrong. But it's not just about having a walk in a park with your phone on the head and you have
No,
to.
no.
We agree. It's about the awareness of being
Yeah.
in the nature. So it's also some kind of like to be focused on being without, for example, a distraction, such as a cell phone, because anyone can go walk in a park with a phone and calling someone or even working. So it's not about that. It's about accepting and realizing that you are right now connected to nature. And this must be the difficult part, no?
Yes. Yeah. I kind of didn't mention that angle, but yes, if you are still on your phone, you're
Yeah.
not really in the surroundings, and it's really about like being in that surrounding, being present. And that's something that we've kind of stopped doing, like the slowing down, the being with yourself. And that can be very hard. That's why many people avoid that, but it is so important for our mental health. So I do recommend, if you do it, try to avoid being on your phone. Absolutely.
Presence.
And
And grounding.
grounding. Yes, I was just going to get
Yes.
into that because you asked about that. So grounding, it's we've also always been in contact with the ground, like directly. And now that, like, nowadays we more and more wear shoes where this contact isn't there anymore because the rubber soles. And it said that there is a certain like a magnetism, a charge that comes from the ground that is actually really beneficial to us. And they did like a lot of tests with it as well, that just being with your bare feet on a grass field or in the forest or on the beach, or even like when you're in a natural water body, there is like this huge impact on our nervous system. It's good for inflammation and it helps us naturally discharge. So that's there's been a lot of research on this. And I do, like, if you think about it, the last time you were really in nature with your bare feet, like especially on the beach, like usually when you walk on the beach and you're barefoot, like there's just like this relaxation. And for me, it just makes total sense when I think about these moments. I am in like a complete state of like more open, more relaxed. And so I fully believe it because you can feel it within.
Yeah, you can feel from your feet, and as we always walk with shoes, we're not gonna walk sadly into the street of London barefoot. It's true
I'm
that
not sure I would recommend, no.
don't recommend either. You lose a sensation because we have so much nerve on the feet that are directly, are linked to our brain. That I believe it's highly important, as soon as you can in a natural environment, to walk, to feel the grass, to feel the sensation.
Yeah.
And even for the feet, it's really important to be a bit open than to be closed all the time in shoes. So no, this is, I agree, it's a really great one. And I'm sure it could be part of a therapeutic, coaching as well, to force yourself at the beginning to go to a park, remove the shoes, meditate barefoot. Maybe this is
Do it from time to time. See how you feel. And just that's what I'm trying to say. Like, see how you feel. I'm not going to tell you this, you have to do this will work. It's like, try these things, see which one makes you feel good. And I think that's the most important part.
Yeah, it's about the individual.
Yeah.
So, as you must know, Rebecca, so we also try to help people with cold water therapy.
Yeah.
Cold water therapy is being immersed for a short period of time in cold water to release endorphin, dopamine. Can you tell us a bit more what you know about this pain relief and cold water therapy? Anything that you
Yes.
know?
So this one is maybe the one I know the least about from all the modalities. I know it's like really up and coming now, and it has shown like health benefits, like not just for chronic pain, but just in general. It is, on the one hand, the part of being in a natural water body. So if that's part of it, then it comes into the same zone as the grounding. But cold water exposure in general has just been beneficial for multiple reasons. So there has been very good results when it comes to inflammation, that it decreases inflammation. It boosts the release of like all the good chemicals like dopamine. They've really found like it's like a 250% increase. I've seen in some researches. It boosts the immune system. It reduces stress, which and it also has really positive results when it comes to depression. I've heard there's like been a lot of studies around depression and cold water treatment. But like I said, this is the one I know the least about, and it's not something I actively like recommend to try because there's always some like risks involved. And but I have heard very good things. So I'm definitely, if this is something that's calling you, or just to try at home to make it like a simpler environment to take cold showers to see how that feels. But again, like, see how it affects you. And
no, I agree. There is, for some people, it will be a kind of revelation, and they will really put it as their habits, daily habits, like every morning going to the cold ice tube, for 5 minutes. And there is some people that's gonna find another way, to feel the stress or to have this boost of endorphin and serotonin. And we totally agree at Level Wellbeing that everyone has his own way and his own path, to heal naturally and holistically.
Yeah.
So this is something that was really important for us. And for the last question, Rebecca, can you
Yeah.
talk a bit more about breath work, for example, in a daily routine for alleviate chronic pain symptom? And if you could share an insight on experience of the effectiveness of breath work on a holistic method for pain relief. Because we
Yes.
know that you know a lot about breath work, and we are, we just want to learn more and more.
Yeah,
So
so this one is like one of the ones I'm like absolutely fascinated about. It's one of the topics I've really immersed myself more and more into, because if you it's something that happens automatically. So we kind of, I would say, take it for granted almost. It happens on the background, and as long as you're alive, you assume like I'm breathing properly. But if we look into like breathing practices and where they date back to, this has been things that have been dating back thousands of years. They found scriptures where they already discussed like the power of the breath and how you're supposed to be breathing, and it was considered a medicine. And what's really fascinating to me is like, so the way we feel physically and emotionally directly impacts the way we breathe. So if we're feeling a little bit stressed, a little bit anxious, you start to breathe like quickly and really shallowly, so more in the chest area. However, you can also do it in the other way. So you can, with your breath, directly impact how you feel physically and emotionally. So by becoming aware and changing your breathing pattern, you change that like whole physiology as well. So, and one of the problems that we see nowadays, and I've learned that through one of the books I was reading by James Nestor. He just released a book around breath, which like absolutely fascinated me. And he states that 90% of us, so 90%, breathe wrong. And then he gives like all of the examples of how that impacts us, and that it also is one of the main causes of a lot of chronic ailments. So here I was like, okay, this is very relevant, and I dived into it even more. So what he says is like, one of the things already what we can start paying attention to is like, do we breathe through our nose or do we breathe through our mouth? Because so what he did is like there has been heaps of experiments done in the past, and he wanted to try it on himself just to see how quickly it can impact a human being. So him and a colleague decided to do this experiment to plug their nose for 10 days, which is only 10 days. But so during those 10 days, they just lived like their normal life, and they measured their vitals 3 times a day, if I remember correctly. And what they saw is that it had like a detrimental impact on their blood pressure, on inflammation markers, on hormone levels, on it was so many things, and they just started feeling miserable and looking pretty bad as well. And that was only after 10 days. So imagine this is your default for breathing, because you just like adapted that because maybe you had a stuffed nose. And it's so important to start focusing on like, okay, can I change this pattern and start breathing through my nose on an active basis? So before going into really fancy breathing like habits, like having a whole breathing routine, I would first recommend like to go to the basics, like always go to the basics first, and take a few moments in your day to focus like, okay, how am I breathing? Am I breathing through my nose? That was number one. So for the nose, what the nose does, so you moisten the breath, it heats the breath, it filters what comes in, and it also allows you to take in more oxygen. Even if you like can breathe the same amount through your mouth, the amount of oxygen that's taken up, I think, was 20% less, if I remember correctly. So that's one thing. So where are you breathing through? And just by being conscious a few times a day, you can make a new default pattern if you do this actively. And then, am I breathing deeply? Am I breathing shallowly? So are you breathing here or more in your belly area? And then the last one is like trying to slow it down. So we want to avoid this like quick breathing that like makes the stress response bigger. You want to slow it down to activate the parasympathetic nervous system. And these are a couple of things you can do a few times a day. Just check in, just be aware and try to adapt it. And then it will get an automatic pattern again. But the more often you repeat something, the more likely it is that that will become your default.
Yeah, it's a process. It will not happen in one day. It has to be part of a routine daily, then will become an habit. And I think awareness is really the words of this interview is be aware of yourself, be aware that there is an alternative method to heal, and that this healing can start by you first. Rebecca, thank you so much for your time.
Thank you for this
It was
opportunity.
absolutely lovely and a great pleasure to have you this morning with us. We are really grateful that you were able to share your knowledge and to help our community to be more aware. And we are happy as well to have you on the LevelWellBeing team to spread the word of holistic approach to heal naturally. Rebecca, thank you so much for your time. And we'll speak to you soon from the LevelWellBeing team. We thank you so much.
Thank you. Ciao. Is it? I think it's still recording though.
I will. It's finishing. Then I will short it.
Okay, that's fine. Thank you for this. That was really cool.
Oh, it was so fascinating, really. It's really great. Sorry, I love to be in a yoga position on chairs.
I can't see it, but yeah, that's why you're sitting so straight. That's good.